to focus on fighting prescription drug abuse and the fraud that goes with it. The first new resource is a data analytics program at the department called the Opioid Fraud and Abuse Detection Unit. I created this unit to focus specifically on opioid-related healthcare fraud using data analysis. This sort of data analytics team can help us find, as your Attorney General knows so well, the telltale signs by finding statistical outliers. People who are prescribing or distributing far more prescription drugs than their contemporaries in the community. This work can tell us which physicians are writing opioid prescriptions at a rate that far exceeds their peers, how many doctors' patients died within 60 days of receiving an opioid prescription, the average age of the patient receiving the prescriptions, pharmacies that are dispensing disproportionately large amounts of opioids, and regional hotspots for opioid issues. Many of these people, I call them just plain crooks, but it's worse than that. They pretend to be in the healthcare business. They pretend to be providing life-sustaining and saving drugs. But diabolically, they are producing and distributing just the opposite. They are distributing death and destruction and addiction. They may lie, but the numbers don't. We are putting every would-be fraudster and drug distributor on notice that they cannot hide. We will find you, and we will bring you to justice. To that end, I have assigned 12 experienced prosecutors to focus solely on investigating and prosecuting opioid-related healthcare fraud cases in a dozen hotspot locations around the country where they're especially needed. These prosecutors, working with FBI, the DEA, the Department of Health and Human Services, as well as our state and local partners, will help us target and prosecute doctors, pharmacists, medical providers who are exploiting this epidemic. And finally,